Hi everybody. Today we'll be talking about nursing trends, and my topic is access to nursing education. We'll cover why easy access to nursing education is important, how access to nursing education will affect the future of nursing, what nursing education looks like and how it has evolved, and when we will reach a new standard of access to nursing education. So first off, why is easy access to nursing education important? As most of us know, most registered nurses begin as staff nurses in hospitals or community health settings. But with experience, good performance, and continuous education, they can move to other settings or be promoted to positions with more responsibility. Easier access to advanced nursing education will allow nurses to further their careers, like moving from RN to nurse practitioner without having to sacrifice their current careers. There are several nursing career paths supported by graduate-level academic programs. For example, an expert clinician, a clinical nurse leader, a nurse executive, a nurse educator, or a nurse researcher. With a continued nursing shortage, the demand for nursing education will continue to grow. According to the Bureau of Labor Statistics, employment of registered nurses is subjected to grow 16% by 2024. The reason for this growth in demand for nurses is an increased emphasis on preventative care, growing rates of chronic diseases such as diabetes and obesity, and demand for healthcare services from the baby boom population as they live longer and more active lives. In addition, the number of individuals who have access to health insurance is expected to continue to increase because of federal health insurance reform. People who previously were uninsured or found treatment to be too costly will obtain health insurance and have access to primary and preventative care services. More nurses will be needed to care for these patients in offices of physicians, clinics, and other ambulatory care settings. Next, how will access to nursing education affect the future of nursing? There's three major points that I want to make. For one, easier access to nursing education will allow for an increase in the number of nurses. And number two, it will also raise the standards of nursing education, which will in turn improve the way nurses are utilized. And three, there will be more educated professional nursing workforce to lead change and advance the healthcare field. So what does nursing education look like and how has it evolved? I think most of us know that nursing began with no formal education, and even in the Middle Ages, nursing care was managed by deacons and deaconesses. This is the era where medical schools, along with hospitals and charitable institutions, increased in number, but for years, nursing really was recognized as either a punishment or obligation, and nobody wanted the responsibility. But all of this changed in 1860 with the Nightingale School of Nursing at St. Thomas, which birthed professional nursing. Nursing was no longer looked at as obligatory or punishment, but as a profession. Nursing students were handpicked and had to be of good moral character, sober, and honest. This led to formal nursing education in the United States. In 1862, the opening of the New England Hospital for Women and Children had its own nurse training program. Also, following World War II, clinical research became an expectation of health providers, and more nurses sought advanced degrees. Since then, nursing has been viewed by the public as a profession and stands with high regard, so nurses are constantly learning and going to school to get higher degrees. When will we reach a new standard of access to nursing education? Really, all we can do is hope that by 2024 we will have more bridge programs and online programs for nursing education to allow for the increase in this nursing demand. Thanks for watching my video.